Hello, welcome back to the Earle Wellbeing channel. And as we draw to an end of World Menopause Awareness Month, I thought I would pop on here and answer just a few of the most commonly asked questions that we get here at Earle Wellbeing magazine. I've got a little list of them for you. And the first one really is about timing. And it's all about whether it's ever too early or too late to start HRT. Well, whether it's too early is an interesting one because there's a big debate going on about whether women should actually take replacement hormones at the first little sign or even before they get any signs of losing their estrogen, because all women will lose estrogen as they age. And that age can vary. You know, it can start for some women as early as their 30s. Surgical menopause obviously can be a lot earlier depending on medical treatment. But for most women, perimenopause, which is the time before menopause, so you've still got your periods, they may be a bit erratic, but they may not be. You may be feeling that your menstrual cycle is actually completely normal, so you might not even consider that you could be perimenopausal. But you may notice a few changes. You may find that you become more anxious, anxiety levels are heightened, you may be suffering from a low mood, thinking that you're depressed. You may get all sorts of weird symptoms like achy joints, things we've talked about before, unusual symptoms that aren't often recognised, things like vertigo or dizziness or tinnitus or hearing issues. And the reason that the symptoms are so varied for all women is that we have estrogen receptors on every cell of our body. So that's why that our brains can feel strange with our mood. We might have like a flatness, a sense of losing our joy. We may lack confidence. We may suddenly become less social. Some women stop driving because they feel so anxiety ridden. So there's lots of early warning signs, if you like, to look out for. For me personally, it was disrupted sleep. You know, I didn't have the classic hot flushes, and I didn't realise that me waking up at 4 a.m. with a racing heartbeat was actually something to do with having lower estrogen levels. So in answer to the question, is it ever too early? I think keep a close eye on your symptoms. Be aware that changes in mood, changes in your physicality, things like achy joints, recurrent UTIs, recurrent urinary tract infections, you know, can be a sign of lowering estrogen. And for me, I wish I'd started HRT earlier. You know, I wish I'd known about those symptoms. So is it ever too early? I think if you are tracking your symptoms, definitely have a conversation with your GP. There's a brilliant app, it's a free app, the Balance Menopause app, and you've got a symptom tracker. We've also got a free symptom track sheet that you can download from Earle Wellbeing. I make sure I pop all these connections actually in the link here. So there's a great podcast that I did a couple of weeks back with Dr. Rebecca Lewis, talking all about timing for HRT. So the part B of that question is it ever too late? Well, the NICE guidelines on menopause, which all GPs should be guided by, are very clear on this. There's no upper age limit. It used to be that the cutoff was called like 60, and certainly over 60, if you've never had HRT, GPs may be more hesitant, particularly if they're not familiar or confident or comfortable with prescribing HRT routinely. But it's never too late. And I'm going to share a personal example of this. My mother went back onto HRT aged 80. Now, it did take 3 different GP visits to enable that to happen, but she is just doing so well and her sleep is so much better. And as we know, sleep is fundamental for well-being. So again, the NICE guidelines, very clear on that. There is no upper age limit as long as women feel that they're getting relief from their symptoms. So it's definitely worth something to discuss and consider with your doctor. I have written a guide actually called The Truth About HRT. Again, I'll pop a link to that. And that describes all about age limits and the different types of HRT and how to have conversations with your doctor, and also how to push back if your doctor is perhaps not listening to you in the way that you would like him or her to do so. So I hope that's helpful. I hope that's covered off the age questions. This is another question, I guess, related to that. And the question is, coming off HRT, how do you come off? Should you gradually reduce your dosage, or do you take it forever? Well, I guess that's linked to my first question, isn't it? Basically, hormones don't accumulate in the body, which is why it's a daily thing. So if you think about it like we would think about the contraceptive pill, you know, if you miss taking a pill, there's a chance you might get pregnant. And the reason for that is that the hormones don't stay in your body to protect you against an unwanted pregnancy. And the same is true of replacing your hormones with estrogen through HRT. You know, the minute you stop taking it, it's out of your system, which is why it's a daily thing. You're either rubbing on a gel daily, or taking a tablet daily, or you've got a patch which is releasing daily. So you don't need to think about titrating your hormones down, because the minute you stop it, that's it, it's out of your system. Should you stop it? Should you come off it gradually? I think that's a real personal decision and something that you need to think about. And if you do stop it, and I know many friends who've sort of suddenly stopped it and their symptoms have come back, and they thought, well, I'm going back on it because I don't want the achy joints, I don't want the heart palpitations, the hot flushes, the sleeplessness. So I think be guided by you. You know, we now know that hormones are health protective. They're protecting our heart, our bones, our brain, so many different things, so many of the risk factors for us in terms of general health as women as we age. So the more hormones that we can replace, potentially, the better our health outcomes. And for me personally, this is not medical advice, this is my personal experience I'm sharing with you. I intend to take HRT forever. So that's my view. And again, you can read about that. There's lots online, there's lots of forums that you can join. And again, download the Menopause app, the Balanced Menopause app, that gives you lots of information about that too. The third question I've got here is alternatives to HRT. What else can you try if it's not working for you? Well, the first thing I would say is don't just throw everything away because you find it's not working, or you're experiencing bloating or breast tenderness or intermittent bleeding. You know, HRT, unfortunately, is not one size fits all. It varies from woman to woman. What works for me is not necessarily going to work for you. I was very fortunate. The minute I started applying the estrogen gel, I had a fantastic night's sleep for the first time in years. So that was a real indication for me that it was working immediately. Many women find that they have to adjust the type or the dosage. And in fact, I've had to increase mine over the years. I started with 2 pumps of the gel, which was definitely fantastic. But I have found that over the years, I need a bit more. So I'm using more gel. Will I continue to use more? I don't know. You know, I experiment every now and then. I don't rub in quite as much and I see what happens. So it's a very personal journey, and one that you're going to have to be guided by your own symptoms and how your body is responding to it. But do keep in mind that we're all different and there are different ways to use HRT. So for example, if you have progesterone, that's the other hormone that you need to have as part of your hormone replacement if you still have a womb. Women with hysterectomies or who had a hysterectomy don't need to have that part of it, because the progesterone part is the bit that protects the uterine lining. It helps guard against uterine cancer. So that's why if you have a womb, if you have your uterus, then you need to have that progesterone part. But some women are quite sensitive to progesterone. There's lots of chat on the forums about this. And progesterone can be used off license vaginally. So it's a tablet that you take, a little capsule called Utrogestan, which is micronized, body identical progesterone. You get it from your GP. It's available on the NHS widely, hopefully in your area. I think there might be an issue with Scotland, but hopefully for most in the UK, they can get access to Utrogestan. But again, some doctors who are confident about prescribing HRT, if there's a progesterone issue, they may suggest trying it vaginally. So lots of different ways. So if it's not working for you, the message here is try different types and dosages, discuss it with your healthcare provider, and hopefully you will find the solution for yourself. Are there other alternatives? Well, in a word, no. There's a yes and a no. So there's nothing that will replace estrogen. You know, estrogen is your own body identical hormone, and you either have that and you take it and replace it, or you don't. You can eat estrogen-rich foods, phytoestrogens, but I think it's around a third of women don't actually have the conversion process, the genetic ability to convert that into a usable form of estrogen for the body. So it's not a reliable source. So you might eat lots and lots of soya, but it may not be converting into the estrogen type that you need. So that's something that you could consider. There are lots of things obviously that can help with other symptoms. So weight-bearing exercise, vitamin D, calcium, all of those things can help with our bone strength and density, but they're not going to put the estrogen back into your bone receptors. Similarly, things like sage, for example, has been shown to help with hot flushes, really helpful for that for some women, but again, they're not going to replace your estrogen. So yes, there are definitely things that can help, Magnesium is great for helping encourage a better night's sleep. It's good for muscle aches. It's good for anxiety. So those are all things that can help, but they're not replacing the estrogen. So I hope that has helped. And then lastly, and this I guess relates back to the first question, I've been asked here many, many times, should you take HRT if you don't have symptoms, or should you start taking it before you reach the menopause? Well, this is something I'm sure that's going to be an ongoing discussion with women and doctors and researchers for many, many years to come. We are seeing the health protective benefits of replacing estrogen in terms of osteoporosis, heart disease, diabetes. They're even doing research now into looking at Alzheimer's and cognitive function. Could it be in the future that women will be given a health screen, say at the age of 40, and they may be told, actually, your hormones are shifting. We think prophylactically, before you get symptoms, we should be giving it to you. I don't know. At the moment, the research, the studies, the information, the medical catch-up isn't quite there. I personally think that that could be something for the future, and I know lots of menopause specialists who think that that could be the way to go, but for now, we simply don't have the answer to that question. But it's a very interesting discussion, and I'd love to continue these conversations, so do please drop a comment below. I know that it's been such a hot topic, if you excuse the pun, for so many of us for so long, and I'm just so grateful that we've got these periods of time like World Menopause Awareness Day and month when we can openly talk and discuss these things and find helpful resources. So there's lots, of course, on Earle Wellbeing. There's lots of free content. I've got e-guides that I've written that you can download, which are all medically verified and very much evidence-based. So I hope all this is helpful. Let's continue the conversation. I'll see you next time.